discussing about the topic that is the ECT. What is the ECT? ECT is the electroconvulsive therapy. Now, in this topic, we are discussing definition of the ECT, mechanism of action of ECT, what are the indication and what are the some contraindication of the ECT and type of the ECT. Now, ECT is the type of the shock therapy and it is also called as the somatic treatment. Now, you have a question, what is the somatic treatment? Somatic treatment is the relationship between our body and our mind. In short, ECT is in this ECT is a relationship between our body and our mind. Now, and it is founded by the Bini and Sereti in April 1938. Now, we will move on the definition. What is the definition of the ECT? ECT is the induction of the grand mal seizures in the body. How? Through the application of the current in the brain. Now, it is a definition of the ECT. ECT is the induction of the grand mal seizures through the application of the artificial current in the brain. Now, in this ECT, what we are doing, provide the electrical current in the brain and produce the grand mal seizures in the body. Understood? Now, we will move on the parameters. According to American Psychiatric Association, there are a voltage that is a 70 to 120 voltage. In this ECT, what are the voltage used? That is a 70 to 120 voltage used. And duration, in how much time we are giving the ECT, 0.7 to 1.5. One application of the current, that is in the time of 0.7 to 1.5 second. And what is the frequency? That is 3 times in a week. We are giving the ECT in 3 times in a week and maximum 6 to 12 times. And in our disease condition, patients having some disease condition, then we are giving up to maximum 25 ECT in a. And what is a grand mal seizure? Grand mal seizure is also known as a tonic-clonic seizure. And you have a question, what is a tonic-clonic seizure? Tonic and clonic. Tonic seizures and clonic seizures. And combination of the tonic seizure and clonic seizure is called a grand mal seizure. Tonic seizures is how you identify their patient having a tonic seizure and the clonic seizure. Then there is one identification marks, that is the plantar extension. And if you patients having a plantar extension, then you can identify the patient having a tonic seizures. And in the clonic seizures, the reduce the rhythmic muscular activity, and finally that is disappear. Then you have identified the patient having the clonic seizures. And tonic seizures is for the 10 to 15 seconds and clonic seizures for the 30 to 16 seconds, and combination of this, that is known as a grand mal seizure, that is for the 25 to 30 seconds. Now we will move on the mechanism of action. What is the mechanism of action? It is mostly unknown, but according to the biochemical theory, we are discussing the first. We will provide the electrical current in the brain and produce the grand mal seizure in the body. That's why our stimulate neurotransmitter. That's why by the current stimulate our neurotransmitter and increase the serotonin, norepinephrine and the dopamine. This is the mechanism of action of the electroconvulsive therapy. Now we will discussing the types of the electroconvulsive therapy. That is the 2 types of the electroconvulsive therapy. First, direct and the modified. Direct recently not used, but what is the direct and what is the modified? Direct is the artificial current provided without any muscles relaxation drug or any anesthesia. We are not using any drugs or anesthesia and directly provide the current. It's called a direct ECT and modified ECT. Now we are using modified ECT. Recently we are using the modified ECT. Modified ECT is we are providing the artificial current with the presence of the any drugs or any muscles relaxation drugs or any anesthesia. Uh, uh, we are providing the ECT. For example, one patient, we are demoing one patient, we are providing ECT. Then before the 30 minutes of the ECT, that is a one injection, that is a atropine sulfate, uh, we are providing. Why? Because it prevents the secretions and it prevents the aspiration. Atropine sulfate reduce the our secretion and patient to prevent from the aspiration, right? And after ECT we are giving the thiopentine sodium 5 to 10 ml. Why we are giving the thiopentine sodium? For the sedation. And we are giving some muscle relaxation, for example succinylcholine, and after 2 to 3 minutes we are giving the oxygens, right? Understood? Now we are moving on the placement of the electrodes. What are the placement of the electrodes? Then unilateral and bilateral. There are two types, unilateral and the bilateral. What are the unilateral? When we are placing the electrodes on the by one side in the non-dominant side, that is the left side, or if you are writing the right hand, then non-dominant side is the left one. Then placing the electrodes in the left side, and in the bilateral we are placing the electrodes by the both side, right? Now we are moving on to what is the exact position to place the electrodes, right? What are the positions? Then outer canthus of the eye, that is this outer canthus of the eyes, and the tragus of the ear, that is this one. Outer canthus, midpoint of the outer canthus of eye, and the tragus of the ear, that is this the midpoint of the outer canthus of the eye and the tragus of the ear. And in the midpoint, see above 2.5 to 4 centimeter, 2.5 to centimeter, then this side we are placing the electrodes, right? Now what are the indication of the ECT? Mostly in the major depression we are giving the ECT. Most indication in exam, mostly they are asking that what condition you have to give ECT. Then in the major depression you have to give a ECT, and some other condition like the schizophrenia, mostly in the catatonic schizophrenia and the psychotic depression. If then psychotic treatment, psychotic depression is not treated by the drugs, then we are giving the ECT. And what are the contraindication of the ECT? And contraindication is the mostly increase the ICP. What is ICP? ICP is the intracranial pressure. If increase the intracranial pressure, then it is avoid to give the ECT. And some other condition like relative contraindication is cardiovascular disease or cerebrovascular disease, or any other condition like osteoporosis. And now we will move on the side effect. Most main side effect is the loss of memory, not a permanent loss of memory. In this we are giving, if we are giving ECT, then temporary loss of memory and confusions. And in the relative side effect, that is fractures and tongue bite. When we are giving the ECT, there are producing some seizures, that is granule seizures in that, so that's why chances of the having the fractures and the tongue bite. Okay, thank you.